You're on.
Okay, this is the scapula. Can you see it? Okay. This is the spine. And the supraspinous fossa is the area above the spine. And the infraspinous fossa is the area below the spine. And then the subscapular fossa is on the back.
Ooh. Sorry.
And then the acromion process is the bigger one. And the coracoid process is the smaller one. Like A comes before C in the alphabet, so it's bigger. This is the glenoid cavity. And the vertebral border, I remember that this side's the vertebral border because it follows down the spine, the side of the spine, like the vertebrae and the spine kind of go together. And then this is the axillary border, which goes on the side of the armpit. And then there's the superior border, and the superior angle, and the inferior angle, and the scapular notch. And then I'll just pick up from here. Okay, this is the humerus, and this is the head, big part on top, and there's the anatomical neck. Goes around this way, and then the surgical neck is the flat one around here. And then there's the greater tubercle and the lesser tubercle. And in between those is the inner tubercular groove. And then the deltoid tuberosity is the rough part right below that where the deltoid muscle attaches. And then the capitellum, that kind of looks like a little cap on it. And the trochlea, I remember like train tracks. And then the lateral epicondyles and the medial epicondyles, and the medial is bigger. And then the coronoid fossa, I remember this one's on this side because the two C's go together, like capitellum and coronoid. And then the olecranon fossa is in the back. And then the radial fossa is the little one on the front. That's on the humerus.
Press record, of course. Your turn.
Okay.
Go.
This is the tibia, and on top is the medial condyle and the lateral epicondyle, and the medial is on the same side as the process down here, the malleolus down here. And then in between those is the intercondylar eminence, and then the tibial tuberosity is the bump right here. And then there's the anterior crest, and I remember that like ants crawling over a hill, and it's like it's shaped like a crest, and that's your kind of where your shin bone is. And then the medial malleolus is this little bump down here that goes on the inside of your ankle. And then the fibular notch is just on the other side of that where it attaches to the fibia. Just put it going. Okay, this is the fibia. Attaches to the fibula.
You're good.
Okay, this is the fibula that attaches to the tibia, and the top part up here is the head, and then the part that sticks out down here is the lateral malleolus that just goes on the opposite side of your heel.
That's it, right? You're good.
Okay, this is your foot, and from here up are the tarsals, and this one is the talus, and I don't know why, but I always think of like talus about your ankle, like we're interested for some reason. And this is the calcaneus, and you get calluses on the back of your heel, and sometimes if you have a limp you need a cane to walk, so it's like the calcaneus. And then the navicular, it's right here, and the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. And I remember that this one's intermediate because in snowboarding they call it intermediate, and you snowboard on your foot. I don't know, instead of like middle, it's intermediate. And then this one is the cuboid, and it's shaped kind of like a cube. And then these are the metatarsals, and they number from your biggest bone over 1, 2, 3, 4, 5. So just start with the biggest and go over your thumb. And then these are the digits. The digits. And the ones closest to the top are the proximal phalanx, and the middle phalanx, and the distal phalanx. Okay, on the skull, this is the nasal bone right here, and then the sphenoid bone is this entire area, and on the sphenoid bone there's the greater wing, kind of looks like a butterfly, and then the lesser wing is above that, and then there's two fissures in your eye. There's the inferior orbital fissure and
Put it down a little bit. Yeah.
the superior orbital fissure, and I remember that like there's fish swimming around in your eye. And then there is the sphenoid sinus, which would be right here, but you can't see it right now because it's not broken. And then the sella turcica, I remember like people being sold saddles, like we're gonna sell you a turcica. I don't know. And then there's the medial pterygoid plates and the lateral pterygoid plates, and the optic canals. I remember like if you put your sticks in and they cross, kind of like your vision crosses for your brain. So there's the optic canals. And then the foramen spinosum is the smallest one down here on the bottom, and it's on the bottom because when you spin you fall down. And then the foramen ovale, kind of shaped like an oval, and the foramen rotundum is here on the top. It's the roundest one, I think. And then the foramen lacerum, I remember like it's next to the saddle and you have to lacer them up. And then on the ethmoid bone, which is all of this area, there's the perpendicular plate. I guess it goes down in here too. There's the perpendicular plate on this side. And then there's the crista galli, which is like the little girl in her crib, the cribiform plate. And then the nasal concha are just the two bumps on the side right here. And then for the palatine bone, which is this area, there's the palatine foramina, so these two bones right by the palatine process, and then the horizontal plate is just below that.